Hello, you guys. My name is Miguel Gomez, fellow Xraytech student here, sophomore. Here, giving you some more information over this time what to expect for clinicals during COVID. Now, right now, with all this going on, there's several things that programs has implemented, and I know in the bigger cities like Dallas, it took them longer to get back into clinicals compared to ours since there are more higher cases. So depending on where you're going to school or where you want to school, some of this information may vary and tweak, but overall, since they do follow mainly the CDC guidelines, it will kind of be the same. So usually freshman year you'll go 2 days, and then later on in the program you'll start to go more days. So that being said, right now, second year, we go 3 days a week. What has changed is now they require you to wear more PPE, which for those who don't know, it's like you're gonna wear the mask, which we all know we gotta wear. They make us wear like goggles, protective ones. I might have some here. They make us wear like protective goggles. You just put them on. There's different kinds. I mean, there's some that are like almost like snowboarding glasses, more sealed protective, and then there's also the N95. There's various kind depending on what kinds of supplies you have. You know, you wear gloves. We don't really do COVID to patients. Most schools don't let you. Some give you the option if you're able to, if your clinical place has enough supplies. Those supplies are like the N95 mask, and you'll wear the gown. Some places bigger in Dallas I've seen, because I was sick with COVID and my son got sick also. He's a little baby, and we had to go to Dallas, and they had the full-on like suits like from Monsters Inc. If anyone knows, like those yellow suits, like full on, like gay mask, and then with oxygen running, and like the best of the best. Which in our hospital, I've only seen like one doctor have one of those, and I'm guessing that's personal because most of our small clinics they don't have that. And yeah, usually we don't do COVID patients. Well, we may assist, like go to like bring the portable, help them out, but we won't go into the room. A lot of things have changed in clinicals as far as like the procedure that you'll see techs, you'll see them, the paper comes out, they're COVID positive. They'll go to the nurse's station and ask like, okay, what's he's experiencing, because most of the time it doesn't say, it just says COVID positive and you don't know what to expect. So getting that information, the tech usually do that and it helps them. And then from there, or sometimes it won't say it's COVID positive because they're running a test on him, but it'll say some of the symptoms, which we know fever, cough, flu, almost flu-like symptoms. So that sometimes you have to ask if they're, that, because if you don't and you go in there with just like a normal, just little mask and not as much precaution, you can also get sick. And then there's a lot of wiping down. Even right now with flu season, we wipe down everything that the patient touches, that we touches. I wear gloves, and I basically, since I got sick and I don't want to get sick again, I treat like every patient has COVID, or like the flu. So you always wear your mask, always wear your goggles, always wear gloves, always do the most you can to keep clean. Usually in the hospital setting, I don't know about the little hospitals, but in ours is the big one, they'll have 2 portables. They'll have one just for the normal patients, and then there'll be another one usually separated out with, like, they'll use that for COVID. Most of the time, if the patient does have COVID, you usually do it in their room. We'll do portables in the room unless they're needing other other type of treatments, which I've seen, like if they need other exams than chest, they will bring them into the X-ray room. Usually not the main one, the one on the side, and then usually after they finish the exam, you have to do a deep cleaning with special type of wipes, and they can't use the rooms for like about, I think it's an hour or 45 minutes before the next person can go in there. And overall, I would say at the beginning it was kind of frightening going in there, because like you didn't know what to expect. You were kind of like, oh, will I get sick? Oh, someone cough something, you're kind of frightened. But I say over time, you start to get the gauge of getting into rhythm. I always carry gloves in my pocket. I always have an extra mask, because sometimes you put on your mask and it'll rip. I have seen some techs, they'll like wear double gloves, double mask, and then I've even seen some wear like the spray painters, like those big thick sealed ones. I've seen, especially with fluoro, for a while back, they cut out a lot of fluoro because of the aspiration that could happen with the patients. So they cut back on doing that for a while. Now they're back to normal and doing that. I will say, as our instructors, every single day you go in, you clock in. Well, we have an online system. I know some places use paper, but we have an online system where you clock in, and then you send a message to your teacher like, okay, I passed my assessment. They took my temperature at the door. I wasn't interacting with anyone with COVID. I'm good. And then at the end of the day, once again, you clock out or you sign out. Then you send another message to your teacher like, okay, I'm good. I passed my assessments. In ours, they do deduct points if you don't do that, which I understand because it's like a safety precautions, because most of the time, this whole time I've been there, they have not come and check on me in person because they're just trying to be safe. Less people at the hospital, the better. And with all this going on, hospitals have limited the amount of people that are able to like if you're a patient that's sick, they just want you to go unless it's like a child, and they will allow a mom, or they try to limit the amount of visitors or people that can go into the hospital because of all this going on. And I will say that seeing now the mask brings to my attention of how back in the days, how it was when someone had like flu, just a simple flu or something that kind of contagious, how we would just go in there and just take normal x-rays, or the doctor would just go in and talk to the patient like it's nothing and then leave. And now with all those mask things going on, I feel like I'm personally gonna always, even though they'll take the mask away, if I know I'm going somewhere where the patient has a cough or having some symptoms of like just plain flu, I feel like I will want to have that protection so I keep myself safe and not get sick. Surprisingly, the few places I've been to for clinicals, out of all the departments, the X-ray one surprisingly was the one with the least amount of people getting sick. I know that we as Xraytech don't interact as much with the patients compared to like the nursing and the doctor, but it was quite surprising that. And yeah, I hope this helps, and good luck to y'all. Hope y'all stay safe and get sick and don't get sick. And if you do, make sure to go get checked up. They do several kind of testings. I have ours, there's a rapid one, and then there's a one that takes 2 to 3 days. I did learn, the doctor was being honest with us, that with the rapid one, there's like a 75% chance of it being actually correct. Because like with our family, one of my sons had it, and no one else had it, but they treated us like everyone had it. And when I got sick, I communicated with my teacher and told them, oh, I'm sick, I have the symptoms. And then what they do, since now usually you can only miss like a few days of clinicals, and then you can't miss no more because the doctor, well, obviously with all this stuff going on, they put more wiggle room on it. And like you'll just be in quarantine ours for school wise, because it does affect school. You have to stay at home and just do everything online and webcam. So they are working around it. Hopefully, it doesn't affect some of the people, because I know personally me, I'm more of a on hands at school type of person. So it has been a little bit of a struggle, but I'm making it through. And yeah, I'm Miguel Gomez, Xray student, and hope this was helpful.